Imagine this. 1 in every 100 people across the globe is affected by an invisible enemy, an enemy that lurks in everyday foods like pasta, bread, and even beer. This enemy is known as gluten, and for those with celiac disease, it can wreak havoc on their digestive system. Celiac disease is a serious autoimmune disorder where the ingestion of gluten leads to damage in the small intestine, and yet, despite its prevalence, many myths and misconceptions surround this disease. Today we're going to debunk those myths, share patient stories, and provide expert insights to help paint a clearer picture of what living with celiac disease really looks like. Let's start at the beginning. Celiac disease is not a food allergy or intolerance, it's an autoimmune disorder. When people with celiac disease consume gluten, their body mounts an immune response that attacks the small intestine, leading to a myriad of symptoms that can range from mild to severe. The symptoms of celiac disease can be quite varied, making it difficult to diagnose. Some people experience digestive problems like bloating or diarrhea. Others might feel tired all the time, lose weight without trying, or even have a skin rash. But for some, there may be no noticeable symptoms at all. So, how is celiac disease diagnosed? Typically, it starts with a blood test to check for certain antibodies. If the test results suggest celiac disease, a biopsy of the small intestine is usually done to confirm the diagnosis. Once diagnosed, the primary treatment for celiac disease is a strict, lifelong gluten-free diet. This means avoiding all foods that contain wheat, barley, and rye. Sounds challenging, right? But with careful planning and a bit of creativity, maintaining a balanced, gluten-free diet is entirely possible. Cross-contamination is a real concern for those with celiac disease. Even a tiny amount of gluten can trigger symptoms. So it's crucial to learn how to navigate shared cooking spaces, dining out, and social situations to avoid accidental gluten exposure. Living with celiac disease requires some lifestyle adaptations, but with the right strategies and support, individuals with this disease can lead healthy, fulfilling lives. We'll hear from real people living with celiac disease, sharing their personal journeys of discovery, challenges, triumphs, and tips for managing this lifelong condition. Common misconceptions about celiac disease can lead to confusion and misunderstanding. Today, we're going to set the record straight. Lastly, we'll have a Q&A session with experts in the field, answering some of the most common questions about celiac disease. Knowledge is power, especially when it comes to managing an autoimmune disorder like celiac disease. So, whether you're a patient, a caregiver, or a healthcare provider, we hope this video brings you a step closer to understanding the realities of living with celiac disease. If you found this video helpful, consider sharing it with others who might benefit from this information. Together, we can raise awareness and improve the lives of those living with celiac disease. Until next time, stay healthy and stay informed. Stay